The Houston Health Department today is reporting 403 cases of COVID-19, bringing the total case count for the city of Houston to 101,300. We went over 100,000 this weekend, and today we're adding 403. The total number of deaths is increasing by 2. Those are 2 persons who have died as a result of COVID-19. And that brings our total count in terms of people dying from this virus to 1,467. And so you can't just look at any one day. You almost have to look at these numbers that we are reporting over several days, a week or two, to kind of get a good read. Because as you know, yesterday the city reported over 1,300 cases, and today we're reporting 403. I also think it's important to note that over the weekend, I mentioned the number we reported over the weekend. We're also seeing the trends and monitoring things very, very closely. We do anticipate that the numbers will probably be inching up even more in terms of our reporting as we see the effects of the post-Thanksgiving Day situation. So we will see what those numbers will indicate. As we approach the Christmas holidays, Hanukkah, Kwanzaa, again, want to remind people to be very careful in terms of their interactions and to minimize their presence in large gatherings. And I'm also encouraging people who would normally hold their Christmas receptions, Christmas parties by companies and organizations. I would strongly ask that you dispense with those this year and find other ways of celebrating these holidays outside of these big holiday parties and those receptions. Those are just candidates for community spread, and so I will ask that you not do them this year. Today, the Houston Health Department is reporting its latest positivity rate of 8.8%. Last week, we reported 8.4%. This week it's 8.8%. And again, this rate is a 14-day moving average and fluctuates daily as new testing data is received. So again, today is 8.8%, and I'm asking that we do everything we can to blunt the trajectory, upward trajectory. So we want to kind of stop it at 8.8 and then want to start moving that downward. The goal is to get to 5% and below. We reached it before, and we need to get back to it as much as possible. And so let me just stop right there. I'm going to come back. I'm going to bring up Director Williams to talk about the vaccines, the protocol surrounding that. We are hopeful that the FDA will approve the Pfizer vaccine on Thursday, and then shortly thereafter for the vaccine to start being distributed throughout the country. Director Williams.
Thank you, Mayor. This is just an overview of Texas COVID-19 vaccine distribution plan. As we all know, there are multiple vaccines being developed and manufactured within the United States. And the first vaccines could be cleared for use by FDA in the coming days and weeks. As a matter of fact, I think everybody has been hearing that we can expect some vaccine delivery sometime next week. Although everyone wants to get vaccinated, that will in fact be the case, but initial doses of the vaccine will be really slated for critical populations as identified by the feds and the state. If you look at this slide, it shows the priority, the guiding principles for that the state has produced in the vaccine distribution plan. First, protecting health care workers, protecting frontline workers, and protecting vulnerable populations. The initial allocation will be extremely limited, so it will be at least in the first quarter of 2022 2021 before the first tier priority group is addressed. And the first tier hasn't actually been totally developed by the state. Only the first half of that tier has actually been developed. So it's an ongoing process. And looking ahead into 2021 with the next slide, it will be likely at least the second quarter of 2021 before vaccines become more widely available. When it does, people will be able to get vaccinated at their doctor's offices, at pharmacies, hospitals, and other usual sites. A vaccine will be distributed at no cost by the CDC and shipped directly to vaccine providers along with supplies needed to administer it, such as syringes, needles, etc. And I can say that both within the city and the county, we have approximately 500 providers that are either registered or going through the registration process. Each vaccine recipient will receive a card with information about the vaccine they receive, and doses administered will be recorded in the state's MTRAC2 system. That is the state's immunization registry, so that providers and recipients can ensure they receive the correct second dose. Remember, if you get one vaccine, initially you really have, the second dose has to be that same vaccine. The Houston Health Department's roles, although the distribution is a state-driven process, there are roles for the Houston Health Department. Much like our testing strategy that brings resources into vulnerable communities, we'll have a similar approach for vaccines focused on access and equity. We also play a role in recruiting Houston COVID-19 vaccine providers in the state network, focusing on recommended priority groups and geographical areas within adequate coverage. And earlier I referred to the fact that we have currently about 500 providers either registered or going through the registration process. It's important to note that we can also monitor vaccine uptake to identify potential gaps and deploy targeted strategies to ensure vaccine is available to all Houstonians based on vaccine availability. This is exactly what we did during our testing efforts when we saw that there was either slow uptake or there were high positivity zip codes. We actually focused our testing efforts into those areas. We will also serve in our traditional role as a safety net provider by providing vaccines in our health centers and our multi-service centers. We're also going to use what we call a strike team, our mobile units that will be able to move around into targeted areas so that we can make sure that we're getting ample vaccine coverage.
Thank you, Dr. Williams. I just want to emphasize, at whatever point the vaccine becomes available where you can take it, let me encourage you to take it. So, for example, healthcare providers will be up first, but whenever it can get to the overall community, and when you're able to take it, let me encourage you to do it. Whenever I'm eligible to take it, I intend to take the vaccine. In fact, we'll do it publicly because we've encouraged people to get tested. We've encouraged people to mask up, to social distance, to wash your hands. Well, now we're adding another component to it, and that is we're encouraging people to get vaccinated, to get this vaccine. And it will do many things. Number one, it will help to curve the number of people who are having to go to hospitals, the number of people who are being positive. We know we have seen a disproportionate impact on communities of color, low-income communities. And so by taking the vaccine, you end up not only just protecting yourself, but protecting others. So when it becomes available, I kind of want to start talking about it now, even before they start distributing it. When you can, I would encourage you in the strongest of terms to please take the vaccine. Now let me bring up Chief Pena from the Fire Department.
Thank you, Mayor. Good afternoon, everyone. The numbers for the Houston Fire Department continue to skyrocket. Today we are at 144 firefighters in quarantine and 36 that have tested positive currently for coronavirus. That continues to place an incredible strain on our ability to staff units as it has in the past 7 months. We, again, like the mayor mentioned, we encourage people to do the right thing to limit that community spread because it is really affecting public safety, not only fire department, but police department and all other municipal employees that are out there serving this community. So we encourage you to continue practicing the recommended safety guidelines, wearing the mask, proper distancing, and proper hygiene, which will help us stem the sharp increase in this virus. In regards to the occupancy task force, Saturday to Sunday in those 24 hours, we responded to 105 complaints for occupancy. Again, what we're seeing is a tremendous number of people in these businesses. 75% is the governor's order maximum, but more importantly than that is the proper distancing within these businesses. The purpose of the 75% is to allow room to properly physically distance within these businesses to ensure a safe environment. And that's the issue that we keep seeing. Beyond just the occupancy number, it's just the grouping of personnel and people inside these businesses that is causing an issue. So again, we encourage people and businesses to assist us in doing the right thing and providing a safe environment. We're happy to report, Mayor, that we've submitted 1,500 names to Methodist as part of the Phase 1 Alpha, as Director Williams mentioned. The tiers haven't been determined, the second tier, but certainly the first tier for vaccines has been determined. We've submitted 1,500 names for firefighters to receive the vaccine as part of the Phase 1 Alpha group. We're hoping we get 100% compliance in taking the vaccine, but it is voluntary. It's not mandatory at this time, and we'll have the numbers of firefighters that did receive that vaccine once those vaccines have been administered. Thank you.
You know, digital equity is one of the many challenges we have faced in Houston during the pandemic. And most schools are open now, but some students are still learning virtually and must do their homework at home, and that requires a reliable internet connection. And I know Councilmember Carlos Cisneros can speak to this because she chairs the committee dealing with education. I am proud to say that we have developed 2 programs in partnership with Comcast that will benefit those who need the assistance. Last week, City Council voted to launch an Internet Voucher Program by using CARES Act funding. The Health Equity Response HER Task Force has partnered with Comcast to provide approximately 5,000 vouchers to qualifying applicants from now until December 20th of this year. This agreement will ensure qualifying applicants can continue to stay connected to the internet for education, work, and personal health reasons for 1 calendar year. The pandemic has highlighted the importance of quality internet service, particularly for those vulnerable populations who must stay at home to stay safe. The program will provide a lifeline for citizens that have struggled through the pandemic without internet access and a way to stay informed, connected, and safe during these challenging times. And for more information or to apply, you can visit houston.comcast.com, houston.comcast.com. And I also want to thank the Harris County Area Agency on Aging, the Mayor's Office for People with Disabilities, the Collaborative for Children, and Project GRAD. Also, the City and Comcast have worked together to help connect low-income families to the internet so they can fully participate in educational opportunities and the digital economy. Comcast today is announcing plans to equip 9 City of Houston community centers with Wi-Fi connected lift zones before the end of 2020. And for more on that and what it means, please welcome Melinda Little, Comcast Government Affairs Director.
Thank you, Mayor Turner, and thank you for your leadership during the pandemic. 2020 really has been an unprecedented year, and internet now more than ever has become such a vital part of our day-to-day lives. Not only are students having to learn from home every day on an online platform, but many of us, including me, are still working from home using platforms like Teams and Zoom. But because of the pandemic and the safety, many of us are also having to connect with our families at home during these holiday seasons. So at Comcast, we are really committed to digital inclusion and equity. We launched our Internet Essentials program in 2011. Internet Essentials, for those of you who don't know, is a low-cost broadband internet program that offers high-speed in-home internet with a Wi-Fi router for only $9.95 a month for those who qualify. We have continued to expand the qualifications, so now most low-income Americans who live in a Comcast footprint are eligible for Internet Essentials. We've also continued to expand speeds to keep up with technology so that people really can stay connected. But the one thing that 2020 has taught us is that even though we have done all these things, there is still more to do. The COVID crisis has put many low-income students in the city at risk for being left behind. It has accelerated the need for comprehensive digital equity and internet adoption programs. So because of this, we've expanded ways to connect to Internet Essentials. We're partnering with other organizations like the City of Houston to have them help sponsor students to be able to be on internet. We also have been offering 2 months free service to all new Internet Essentials customers since March, and I'm excited to announce today that we are expanding that to go through June 30th, 2021. The mayor just talked about the great partnership that we have with his Health Equity Response Task Force and providing approximately 5,000 vouchers for Internet Essentials for 1 year. We're super excited about that, but we also know that we need to do even more, and so we're partnering with the city to open 9 lift zones this year, and then we have many more lift zones that we're going to partner not only with the City of Houston, but with other nonprofit partners. These lift zones are facilities that are designed to provide safe space for children to come and do their online learning if, for whatever reason, they don't have at-home access to internet, or like me, just want to go somewhere else to do their work for a while, but it will be safe. The lift zones will be located throughout the city with the goal of helping local residents, especially vulnerable and at-risk populations who might not be able to have internet otherwise. Mayor, we are so grateful to you for your leadership in this space, and thank you so much for allowing us to be a partner.
Thank you, Melinda. And those will be 9 lift zones in 9 of our community centers. And I want to thank Area Aging Organization, Mayor's Office for People with Disabilities, for also helping to make this happen. The need for food assistance during the pandemic has also increased greatly. Over the weekend, I was out helping with a food distribution hosted by Mos 45 in the 3rd Ward. But nearly every day in this city, organizations are working to meet the needs of families facing food insecurities because of a job loss or illness as a result of the pandemic. On Wednesday, this coming Wednesday, City Council will vote, Councilmember Cisneros, Mayor Pro Tem, on $2,036,000 in CARES Act funding for the Houston Food Bank to meet the demand for food assistance due to COVID-19. Can't tell you how invaluable the food bank has been. No question that this contribution to them will meet the needs of many, many families. So that's $2,036,000 from CARES funding will be going to the food bank, assuming council votes for it. And sadly, there are cuts to funding and product at the federal and state levels that have the Houston Food Bank and others around the country facing produce and commodity cliffs in 2021. And to assure these decreases don't negatively impact the food and nutrition needs of our communities, the food bank submitted this proposal for CARES Act funding. Some have criticized the city for rushing to spend all the CARES Act funding, but this, like so many other programs, are not only justified, they are sorely needed. According to the Houston Food Bank, distribution has surged as high as 200% of typical service, with March through October 2020 showing a 49% increase in the average number of households served on average, comparing the same timeline to 2019 as a result of the pandemic. So we are doing our part to urgently meet these needs. Council will also vote on providing more than $130,000 in CARES Act funding for BARC, And during the pandemic, the city's animal shelter is seeing more people surrender their animals. The economic impact of the pandemic has in some cases limited the ability of animal owners to care for their pets, increasing the number of homeless animals in our community and animals in BARK's care. Since 2013, BARK has partnered with Rescue Pets Movement to find homes for over 47,993 BARK animals in no-kill shelters and rescue organizations in Colorado and across the United States. This week's item increases BARK's contract with RPM for an additional $131,475 to transport an additional 1,753 animals in order to help reduce shelter capacity constraints during the pandemic. To support BARK's socially distanced shelter operations, RPM increased its transport efforts during the pandemic. The funding will also support a Home for the Holidays initiative to collect stray animals from the streets and provide transport services for up to 500 animals during the month of December 2020. RPM's effort greatly helped BARK's ability to provide a safe environment for employees and the general public through the COVID-19 outbreak in the Houston area. And I believe there are some additional items on the agenda for BARK as well. The messaging, you'll be hearing a lot more as we move forward to encourage not only our employees to take it, but people in the community as well to take the vaccine. So that will help us to get on the other side of what has been a very, very challenging year. Before I close, I want to thank the people in the city of Houston and the businesses, individuals as well as the businesses, for being very cooperative, for keeping your masks on. I want to thank people who are in our city, living in our city, doing business in our city, for keeping these masks on and for engaging in social distancing and washing your hands. I want to thank those businesses, for example, who have reduced their occupancy in order to keep their customers and their patrons safe, and encourage people while they're in their businesses to keep their masks on and engaging in proper hygiene. So I want to thank people for doing your part, because quite frankly, when you look at the situation in other parts of the country, the city of Houston is still, relatively speaking, in better shape, although things can change in a hurry. Let me ask for your continued cooperation in doing everything we can as we approach the Christmas, Hanukkah, Kwanzaa, and keeping people as safe as possible. I know a lot of people will be doing online shopping. I'll be doing online shopping, but occasionally too, I will tell you that I will probably be in the stores. But if they are too crowded, if one is too crowded, I'm gonna come out and go to another. So I'm not telling people not to. I'm just saying be smart shoppers, be safe shoppers, because our businesses do need the business, especially small businesses. And so I'm simply saying let's enjoy the holiday season, but let's do it in a safe and respectful fashion, knowing that the vaccines are coming, and in weeks and months we can be on the other side. So let's patronize our businesses. Okay, let's do that, but we can do it in a very responsible fashion, and that's what I'm asking you to do. Let's enjoy the holiday season. I don't want us to take the joy out, so ho, 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 all that good stuff. And, I'll come in my, reindeer outfit soon. So, with all my F's. So let's be festive, let's enjoy it, let's bring down the stress level, and again, be mindful of the road rage. And what I mean by that, don't get into an argument with people who are driving. No arguments, please. I would not argue with anybody. So too much road rage, bring the decibel down, and then have a safe and enjoyable day. Thank you all so very much. Appreciate it.